Because, I mean, what would you do if you got a phone call? Hey, I heard you have this disease, and I want to give you $30,000 to help with that.
Yeah, you do it. Yeah.
No thanks.
Yeah. Is it a print, Nigerian prince? Yeah,
exactly.
Hey, what's up, guys? Spencer Smith here, host of the Self-Funded with Spencer podcast, sponsored by Pareto Health, ClaimDoc, and PlanSight. Enjoy today's episode. Well, the remote world these days, I mean, Pareto's home office in Philadelphia, and yeah, I've been there 5 or 6 times since I've been here, but it doesn't matter anymore.
Yeah.
I mean, and I don't have a territory like our reps do, but our reps are in territory, so it's important for them to be localized. However, people that sort of sit on top of leadership, I mean, our chief sales officer's in Denver. You know, I think our new president we just announced this morning is in San Francisco. So it doesn't really matter anymore as much.
The COVID killed, or not killed, but it devalued the in-person meeting.
Mm-hmm.
I mean, when, people used to sell, they would go door to door, knock, and here's a vacuum cleaner.
Yeah.
Let me show you. And that was acceptable. That's how people bought. Then when telephone came along, nobody liked that. Then people started taking those calls, and
mm-hmm.
that was acceptable.
Mm-hmm.
Internet killed the telephone. You can't cold call like houses anymore.
Nope.
Internet killed that. And just like COVID forced everyone to get up with the technology and do these video conferences, now it's acceptable to do those instead of, oh, well, this guy didn't appreciate me enough to come out here in person. Now everybody kind of has gone on board with that efficiency.
Mm-hmm.
Instead of having 2 meetings a day where I got to ride out and all, I can have 6 meetings.
Well, I went up and did a talk track I called Compelling Selling, because one of the things that we really focus on with our salespeople is, you can be accurate, you can be concise, you can be clear, but if you're not compelling somebody to the actual concept and swaying their emotion, you might not get a sale like what we do at Pareto. But one of the things that was talked about up there was, one, the in-person meeting that's more effective, let's say. We believe conversion rates are higher, but it's far less efficient. So I kind of weighed that with the group. It's like, hey guys, your co-founder Andrew Clayton says we should be in person as much as possible for meetings because we're really effective at selling that way. 100%. Mm-hmm. You have to evaluate though, based on the size of your territory in a huge state. Could I do 6 meetings in a day virtually or 1 in person because I've got a 2-hour round trip? You might go to that 1 in person because you're probably going to close it. Cool.
Yeah.
But what are you doing the rest of the day? Or how many more meetings could you have virtually? What's your close ratio? And so there wasn't a right or wrong answer, but just sort of an onus to say, hey, you're a professional, but think about these things. Because I used to sell software, and I could have 8 to 10 meetings a day.
Right.
And I just needed to crank through as many prospects as possible to sell that way.
Right.
Yeah. But I would always jump at the chance to in-person because there's just something just like this, right? Knee to knee, you and me, same room, no distractions. Nobody's on their laptop with their camera turned off, being
mm-hmm.
rude. Just you and I or the group talking about it.
It's taken more seriously.
Yeah, I think it
by
is.
everybody.
Yeah.
To set the phones down. Let's dedicated this time, and but
when you appreciate it more too, it's almost like, oh, they traveled in to see us, right? They put forth effort, so we're going to give them our undivided attention and response.
It's actually given more value. Like, wow, he's coming in person.
In person, yeah.
He's taking the time to do that. Where that's rare now.
When I set this up in 2020. We'll get started here in a second. I set this up in 2020, almost bucking the trend of virtual, right? I thought, well, everybody's probably craving getting together again. Like, we can't get together for meetings. What if I just did a podcast in person? We played by the rules, but you at least got to see 2 people sitting in the same room, which was a really novel thing in 2020. Mm-hmm. This idea of people traveling in or being on a podcast. And so I look at this, you see the studio, obviously we can control all the variables. I don't have to worry about your internet. I don't have to worry about lag. I don't have to worry about your audio. And then there's something to be said. You made the effort to come here, so I want to do everything I can to kind of pour into you and back to thank you for doing that as well. So I just think I don't know, it's my opinion, but it's worked so far.
I agree. I mean, it has more weight to it. I mean, like you said, I mean, people take it more seriously, and where that's not done a lot nowadays. So
it's not, man. But let's go ahead and kick it up, Brett. Why don't we'll start the podcast in your awesome green jacket that I've been complimenting you on so far. So I'm with Brett Morris. You said you're the CEO of not only the Samaritan Fund Program, right?
Correct.
In
Yeah.
the Samaritan Fund Foundation.
Samaritan Fund Program
Yes.
and the Samaritan Fund Foundation.
And we're going to talk about why those two things coexist and need to exist for what you do. But why don't we real quick, Brett, before we get into your background, and then we'll obviously go deep into Samaritan Fund, but what can you just describe for the folks that are listening to this episode and, want to know what we're going to talk about? What is the Samaritan Fund in this program on its surface?
So the Samaritan Fund program is what it does is we've created an alternative for people that are dealing with high cost medical claims, going through a difficult diagnosis. These people, they need help. We found that when faced with a difficult disease, more people are concerned about their cost of the care first, and then the disease afterward. And that, that's a lot of anxiety for people. Our tagline, our slogan is "Given the peace of mind to heal."
Okay.
If you've ever dealt with someone who's dealing with something that gives them a lot of anxiety, you know that has a physical effect on the body.
Absolutely.
And if we can take that anxiety away from them to where they can focus on their health, that's our mission, that's our cause, that's what we want to do. We've also done it in a way where we help these employers as well to mitigate costs. And they have their own set of anxieties too. I mean, especially the mid-market gets hit very hard. And I've had companies like, look, if we can't find a solution, I can't offer insurance anymore.
Right.
We just can't afford it. And that's a real problem for them as well. So we're really, it's a win for everybody. We do it to help the people that are struggling in these situations and help these employers as well.
Well, yeah, and it's a rare situation. And again, we're going to unpack how it works and all the regulations and everything you've done to construct this in the proper way so it's above board. But there's a rare confluence here where it's helping kind of folks that are in a really tough situation personally. Then you have the employer side who's wanting to offer great group benefits, but might have a very high cost claimant, the term we use very commonly, that they just don't know how to mitigate the risk and the cost of that person. And then you everybody within that employee benefit package as well kind of sinks or swims based on perhaps one or two individuals on the plan that costs a lot of money. And so all these constraints happen, and there hasn't been a really good turnkey solution, if you will, in the marketplace. And then you came on my radar maybe about a year ago now. I can't remember exactly when. Started to hear some rumblings in the market, and I said, I want to know more about that. We had a couple conversations, and now obviously you're here to dig deep into what it is. Before we do that, though, if you don't mind, I'd like to hear your backstory because you were a broker, financial planner. You got an interesting story that's led up to you being here. So why don't you tell us a little bit more about yourself, Brett? Pareto Health is the manager of the largest employee benefits group captive in the United States. And it's also now the main sponsor of the Self-Funded with Spencer podcast. I chose to partner with Pareto Health for three main reasons. Number one, their dedication to improving the world of health benefits. Number two, their mission to reduce volatility and to make self-funding simple for mid-sized employers. And number three, the strength and scale of their program. With over 2,300 member groups and more than $1 billion of stop-loss premium under management, Pareto Health is the most robust solution of its kind in the country, period. Stay tuned for more information because I'm sure I'll be featuring them on an episode of the podcast very soon. Visit Pareto Health at paretohealth.com or follow them on LinkedIn to stay up to date on the latest news and developments.
Yeah, so I went to college at University of Southern Mississippi, and I had a unique major there for financial planning. And it was kind of a double major in mathematics and economics, but the dean there set it up. He was also on the board of the American College, to where we'd graduate and have CFP. And so instead of giving us a test of that he'd have to make, he'd say, well, go past the Series 7, and that'd be your test. And go past the Series 66. And then our final exam was the cumulative CFP exam. And so walking out, everybody, they had kind of the CFP did require you to have some experience, which we didn't have at the time, but we'd already passed the test.
Yeah.
And so kind of got into financial planning, and was feeling pretty good. Graduating, had those difficult tests out the way, had some letters behind my name, and I got a little dose of reality when I was like, okay, you can you can let the first millionaire in now, and I got all the answers.
Yeah,
and they're
yeah.
like, no, you go find them, and so.
And I imagine
that was
what
a
at
reality.
23 or whatever, your Rolodex of millionaires that that your financial advice is probably pretty short, right?
Oh yeah, they tell you to find your natural market. Write down as many people, your peers in your peer group that have a liquid $1 million. I'm like, look, my peer group is in debt, and still partying and trying to find a job. So
they consume a lot of liquids. They're just not liquid $1 million. Yeah.
Yeah, they're still living with their parents. But so I had to learn how to sell like 20 years out of my peer group. Which had some struggles. Luckily, I had a great mentor that came to me and said, look, I got something you can't get from a book, and that's gray hair. And so how about, we team up, and learned a lot from that experience. And I kind of gravitated into employee benefits when I decided I need to meet people with funds. And so I decided I'm going to call on businesses to write 401k plans. I'm going to enroll them myself and maybe meet some people with a lot of money. And that worked well for me for a while. Then they started asking me well, do you do health insurance? Do you do other things? And so that's really where I got my start with the employee
When you were
benefits.
saying, as you eventually transitioned from the financial planning world into the benefits world, that one of the things you had to sort of weigh is how much insurance you're having to carry on yourself for like errors and omissions style insurance. And I didn't realize that was part of the equation. Could you tell me about that, or tell the audience about that as well?
Man, if for all those insurance agents out there that are worried about the continuing education credits, keeping up with it's nothing compared to if you're doing securities trading, and the insurance that you have to cover for that, and the compliance that you have to do for all that is very time consuming. It's very expensive, and so if you don't have a tremendous amount of assets, it's really not worth it.
Yeah.
And so you really have to kind of you have to pick your specialty, and though I was doing well with that, I thought I could do better with the employee benefits.
So you basically just turned that side of your career off, right?
Eventually I did, yeah. Passed that off to one of my partners who, that's all he did, asset management, and walked away from financial planning to do more of business planning, employee benefits planning.
Okay. And then so you transitioned to benefits. You said you're there in Louisiana, a couple agencies I think you told me over coffee that you work for. But ultimately, like you found your way into self-funding at some point, right? So talk to me about that introduction and why you gravitated towards that.
Well, I was very aggressive. I liked finding solutions, and I needed something to make me stand out. And I guess leaning on my strengths, just being the analytical type, I wasn't able to do anything more in the fully insured than just quote them all, put them on a spreadsheet, and well, his current broker is doing that, so.
But you have great service, right? Or whatever the things that you
yeah,
tell,
of
as
course,
differentiators.
and that really, that again, that was a hard sell there. I needed to make it win with the numbers, and that's just how my mind worked.
Yeah.
And self-funding allowed me to do that, to do things that had an effect on the claims, had an effect on the numbers. And so with that, I started working for a agency / TPA, to where I learned the components, the guts of an insurance plan, able to piece it together and learn about all these strategies. And so that gave me the control that I needed to really create a better product. And
well, that's what I like too. I was introduced through the numbers. I was a financial analyst, so my job was putting together a lot of the actual, taking those TPA claims reports, the spec and ag reports, and the high dollar claims, and putting that into a broker branded version that we would show our client every month. And so I was forced to learn how it worked, because I needed to know how the dollars flow and what things meant. And that is that minus that, so that equals that. And just the math side of the house was how I got into it. And like you, I gravitated towards that simply because I could do more things. I could then, there were so many more levers you could pull, and it just seemed a lot more interesting because it was almost an infinite possibilities in terms of strategy. So did you then start catering towards clients specifically up market that wanted to be self-funded and only wanted to work on those types of groups, or what?
well, yeah, that there were a lot of competent agents out there, a very competitive industry. And so my Blue Cross quote was the same as the Blue Cross quote that they were already getting. And and so I needed an edge. So I got to, have some strategies on how I know what works better in certain markets. And so I went after those that maybe would be good candidates for self-funding and didn't understand it. And that's where I ended up building my book of business.
Right. And then, so how many years were you actually in the broker business?
Ooh,
I'm not trying to date you. Just curious how long you spent in that world.
over 10 years.
Okay.
Over 10 years.
Right on.
Yeah.
And then where was the recognition, like as we sort of shift into the Samaritan Fund Program as well as Foundation, where was the recognition that there was a piece missing? Did you have one particular case that you're dealing with, a really complicated high-cost claimant, or was it just a bunch of small ones over time?
It wasn't what led to the development of the program. It wasn't just one case. It was really multiple, and I think every agent comes across it. And it's the basics of insurance that you're going to have these high claims at the top,
Mm-hmm.
and it's $1 trillion game of musical chairs. The music's going to stop,
Mm-hmm.
and who's it going to be?
Mm-hmm.
And why don't we all just pitch in a little, because we can't all afford it on our own, and buy another chair? And so, but what if we knew who that was, and then that high claimant can get carved out of the plan, or we were able to find a solution for that person that significantly affect the total claims, because everyone else on the plan is pooling for that one claim.
The one person, yeah,
That one
absolutely.
person.
Yeah, I think you were talking about the musical chairs and adding a chair. I was kind of educated in a way that risk never leaves the pool; it just changes hands, right?
Mm.
So, let's say you design a plan that incentivizes a spouse to now no longer take their husband or wife's plan, but they take their own, right? You didn't get rid of the risk. Now it's just over here,
Right,
some other
exactly.
employer's problem, right? So it's
Right.
almost a competitive way to offload the risk, but it doesn't mean that person's claims themselves go away. And so, to my knowledge, to this point, I haven't seen a very good mechanism to deal with those truly, truly large claims that oftentimes employers I don't want to say handcuffed with, but they're really left with limited options of what to do about it. So when did you have your aha moment that I can do something about it, and there's a way that I could do this that nobody else has been able to do that? Tell me about that epiphany.
Yeah. So, I kind of found that, working with these high dollar claims, every broker was dealing with it.
Mm-hmm.
And, if it was $1 million claim, what would happen? The CEO or CFO, they'd say, okay, everybody get out of the room. I want to talk to just me and Brett. And they'd lean over and they'd say, Brett, can't we just give this guy a bonus and get him off our plan? He's costing us $1 million, right? And of course, the answer to that is no, you can't do that. That's discrimination, and you're going to get yourself in big trouble. But what if there's a way that we could do this compliantly,
Mm-hmm.
and safely, and it helps that individual? And because I was there concerned too. Well, I want to help this person. I'm not just wanting them to save our claims, but I want to make sure that they're taken care of too.
Yeah.
And so, is there a way that we could do that? So really just started digging into the compliance of it and how that could be done. And that's how we came up with this.
Well, and you're saying it kind of is an inverse. So there's other options out there where we'll get a lawyer for that employee, and then we'll have lawyers for ourselves, and then we'll put these lawyers in a room and talk to each other, and now it's attorney-client privilege or something.
I've seen some strange ways that they've pieced it together to do this, and some of them really fly close to, is it compliant? But even if it is compliant, it's not safe.
Yeah.
It's not safe for the employer. It's a very awkward conversation for an employee to talk to their employer
Mm-hmm.
about how, I'm costing you $1 million a year. They're very sensitive, and the elephant in the room is, well, there's somebody in an office somewhere doing the math, and the bottom line is better with me gone because of my illness.
Right.
And so they don't want to have that conversation with the employer, and all these other strategies that I've kind of come across all kind of required the employer to really bring that up, and even some of these employers, that I was dealing with when this came up, they're like, well, Brett, what are we talking about here? What risk? I mean, if I get fined, if it's $500,000, I win. This is $1 million claim. I'm going to sit them down. I'm just going to level with them. Like, dude, you're crushing us, and I'm sorry, but you got to find another way. And they were willing to take that risk, and I'm sure some of them got burned from that. But of course, as an advisor, you cannot. I mean, I wouldn't recommend you do something like that. I mean, there's no telling what that could cost you in the end. They could end up shutting down your company. But so we needed to find a way to where everybody wins, and we believe we've done it. So.
Yeah. So like, as much as we can talk, and I know you obviously you want to make sure that as public as this may be, that you'll talk about what you can talk publicly, but let's talk a little bit of the how it works, because I think it's important. We'll get in the compliance side. People are going to go, well, wait, how's that possible? But I just even want to talk about how the program itself works. So maybe we pick a certain use case or something like that, and you walk me through what that would look like.
Sure. So what we do is we find third-party funding from these that we call Samaritans, to help out the people that are struggling with these high-cost diseases. On the philanthropy side, I was very good with the employee benefits industry. That was my world. That's what I knew. I was a little new with this foundation world, which we needed to build a portfolio of Samaritan sponsors to give our participants the funds, because that's what made it compliant. That's what made it safe. The rules are pretty clear. As an employer, you can't incentivize an employee to leave your plan, and as you also can't indirectly incentivize an employee to leave your plan. Meaning, the employer can't pay my company and then my company and give it to your employee. That's not going to work either. So all the funds that go to these individuals are coming from these third-party Samaritan sponsors. That's what makes it compliant, and that's what makes it safe. And so, I found out that these our Samaritans comes in all shapes and sizes, but some of these large foundations, they knew they do some things not so well. One is finding the people. And my pitch to them would be, well, if you want to help kids, I know where the kids are that need help. We become this bridge from the foundations to the employee benefits industry and all these employers. And so we can help them fulfill their mission, fulfill their cause, and then get specific if they want. I want to help kids with cystic fibrosis. That's fine. I can put you in connection with that.
Okay.
Another thing that helps them is the way we give them the funds. They're not very good at that either. They have grant applications, and then they check up. We want the receipts of everything. Well, with our debit card system, we're able to cut through all that red tape to where, again, we can give the funds to the people that need it, not give them any more anxiety and headache and paperwork, and give them the peace that they want.
Well, and so the idea, right, is that you're creating a win-win. You're almost like a Match.com, if you will, where you've got the foundation that wants to give, you've got an individual in need where you match those two things up, and now you've got a solution. But the member, right, it's very important to you to make sure that member is not put in any sort of detrimental situation, or that it's safe. You keep using that term as well. So what does it look like from the individual side? Let's say I'm one of those people that does qualify for this program to receive those funds. What does it look like me now for my plan year instead of what it would have been prior?
Yeah, so all the employer does is help us advertise our program to all the employees. And they send it out to everybody, and that everybody can apply, but not everybody can qualify. Is for people that are struggling. And if you're struggling with high-cost medical bills, or you're faced with a difficult diagnosis, then reach out to Samaritan Fund Program. You could get all your bills paid for. And so they help us distribute our marketing materials. From there, the employee reaches out to us privately. They sign their own HIPAA form, because again, they don't want to talk to their employer about their situation. So we help them directly. We get their situation, we get their unique story, to go out and find the funds for them. So as an employee, you see how your employer, you find out about it by your employer. They reach out to us directly, and then if they qualify, we find the solutions for them that way.
Okay. And so that individual, like, I'm sure that's met with a little bit of skepticism up front, right? So some of what you're providing is some reassurance that this is like legitimate, right?
Right.
This isn't some back alley transaction we're doing where I throw some money in a duffel bag. So, you probably have to walk them through a little bit of like comfort. No, this is how it works, and this is your benefit, and this is why we do it. So do you put their mind at ease in that first phone call as much as you can?
Yeah, I think if you talk to our implementation team, I think almost all of their first reactions are, is this for real? Where's the catch? And I think we have to, they have to find out about us through the employers, in my opinion, because, what would you do if you got a phone call? Hey, I heard you have this disease, and I want to give you $30,000 to help with that.
Yeah, you do it. Yeah.
No thanks.
Yeah. Is it a Nigerian prince? Yeah,
exactly. So they only really respond to us because, hey, this did come from my employer. Okay, we will look into it. There has to be a level of legitimacy here. Mm-hmm. We'll look into it. And they are still kind of skeptical, but you'll see from our feedback, that we get from a lot of the lives that we changed.
Yeah.
Like, man, I thought there was some kind of catch to this. It wasn't. It changed our lives. And then when other people see their fellow employees being helped, we get a little bit more momentum that way.
Yeah.
And people moving forward. But that is the first reaction, that this can't be true.
Well, I imagine there's some inherent skepticism even from the employer, right? This has to be too good to be true, right? I'm
Right.
sure you have to field a question like that all the time. I don't know what the psychology is of having that conversation probably over and over again until this would reach a critical mass where it becomes a lot more commonplace. But it does almost seem too good to be true because it hasn't been done before.
Well, our message is kind of the same, that there are people out there that want to help.
Mm-hmm.
And, but they need to find those that need the help.
Yeah.
And we're kind of similar to, I guess with these programs, like these PAP programs for pharmacy, and those exist on their own. And these foundations, the people that want to help, they have funds and all, they exist on their own. And like these PAP pharmacy plans, technically, those people that had taken those drugs, they can go out and apply and get those things. But the average person doesn't know how to do that. They don't know where to go.
Yeah.
They don't know where to apply for that. If people need help, just in general, people have a hard time reaching out for help, just in normal situations, and much less know where to go for it. But for us to be able to organize it, put it together, not only organize the funds that these Samaritans want to give, but organize it in a way for, hey, you need help. And some people, you can look at your own lives in any aspects. We have a natural tendency to, well, I don't need help.
Yeah, I'm definitely that way.
I'm very private, and this is my battle. This is that. No, reach out for help. There are people out there that care about you and want to assist you, and so we encourage them to reach out, and we find the help for them that really already exists.
It's a situation, and it's not only, let's say we got $1 million claim out there. Obviously, the employer is benefiting from this arrangement for that year at least. Mm. The employee, like you stressed again, it's the benefit to them because if they're $1 million claimant, they're hitting their max out of pocket every year as well. And the majority of people, whatever their max out of pocket might be, $9,000, $12,000, $15,000, you name it, they can't afford that. Right. And so it goes back to like, well, it doesn't matter if it's a $10 million claim or a $50 million claim.
Right.
I can't afford my own out of pocket for this year alone. And so then they have to start making really difficult decisions about not seeking care or delaying care, avoiding it. None of those outcomes are optimized for the individual. Mm. And so I think what this does is now take that pressure off them, the financial burden, so they can actually go seek the care that they need. You were telling me a circumstance, I don't think this is a personal story, you were telling me where somebody went in to go to the hospital and then they met with the person that helped them set up a GoFundMe or something like that. I remember you telling me that story over coffee. PlanSight is a complete game changer in the world of insurance brokering. As a broker, you know how time-consuming and error-prone the traditional RFP process can be. Well, what if I told you there's a better way? PlanSight is the only end-to-end RFP solution on the market made specifically for benefits agencies. It's like having a superpower that gets you an average of 8 to 10 hours back per employer renewal per year. And the best part? PlanSight supports all carriers, all funding types, and all group sizes for over 20 different benefits. If you're ready to make your RFP process faster, more efficient, and more profitable, it's time to call PlanSight. Visit plansight.com now to book a free demo and discover the future of insurance renewals.
Yeah, so, I knew this went on, but I actually found this firsthand with my mother, who was getting a double lung transplant. And one of the people she met with through that whole process was someone who would help her set up a GoFundMe or a foundation for all of her friends and family and all to donate to help her out with that. And so that happens all the time. I thought it was a little ironic that the hospital was helping her do that for the bill that they're about to send her.
Yeah. Like, this one's going to be big. Okay,
so
down.
You're going to need help with this one.
Yeah.
But that's done all the time. So, why does the hospital need to be doing this? We need to be doing this for everybody, because what if it's a high cost prescription, maybe that is maxing out your insurance? It's the number one cause of bankruptcy. And Kaiser Foundation came out, I think 2 years ago, with a study that 100 million Americans, that's about 42%, are in some form of medical debt in America. And it's not because these people are going bankrupt. It's not because they don't have health insurance. They do. Correlate that line to how many people right now can cut a $5,000 check.
Yeah.
Who has savings. Not many people. They're living paycheck to paycheck, and that's why it cripples them. And so you're left with these people that they have this anxiety of, well, I can't afford my deductible and out-of-pocket maximum. I need this care. And if I can't go in and pay it, the hospital's going to turn me away. And I can't get the care that I actually have insurance for. And it's a struggle for them. Yeah. And so that's what we want to help them with. And so we provide them with the funds to take care of their cost share with that as well. And a lot of times it's not just cost share. These employers, they face a difficult decision as well, that they start carving certain things out of their plan that isn't on the surface. I remember we had a case that great insurance, she had a 100% premium was covered by the employer. The out-of-pocket maximum for the year was $250. That's it for the year. Okay. Super rich.
That's an awesome plan. Yeah.
There was only one problem. The drug that she needed was too expensive. And so instead of raising the out-of-pocket max or the deductible, which would make this company uncompetitive to their peers, because they had to show that, hey, we got a low deductible, too, they just carved out the plan that carved out the drug that she needed.
Oh, wow.
And so, and she told that, well, I tried to apply for things and that would help me. Well, do you have health insurance? Well, yes. Well, what's your deductible? It's $250 max out of the year. Well, you don't qualify for this. Well, you don't understand though. It doesn't cover the drug that I need. Oh, we don't have a box here for that. So, you don't get.
Do you know what happened in that circumstance, or did she find alternative medication, or you helped them?
We helped them. She enrolled in the Samaritan Fund Program.
Wow.
And we found her alternative coverage that would pay for that, and we're able to help her out.
Well, let's talk about the donation side of things, right? Because this is all predicated on being able to find the funding and the people willing and wanting to give donations. So what are some of the forms? I mean, you mentioned perhaps there might be programs for specific disease states or for children per se, but that's not the entirety of the pool, right? There might be some high net worth individuals, people just want to help crowd fund, if you will. So talk to me about that side of the equation.
Yeah, sure. So we already talked about, we want to partner with other foundations and charities that already have missions to help people, and we can connect them to those people, and also administer the funds to get them in a very efficient way. But we also have campaigns for employee giving.
Okay.
And if you'll see some of our materials, we encourage, if you don't need a Samaritan, be a Samaritan. And this is getting more popular, usually in year 2. Like we talk, year 1 is this for real? And year 2 is, well, I had a friend that they helped out, a fellow employee, and this is something I could get behind, change their lives. Yes, I'll donate $5 of my paycheck to help somebody in need.
Oh, so they can donate even very, very small increments towards a pool.
Absolutely.
Okay.
And so some of the employers that we work with, we'll ask them, hey, would you give us a payroll deduction slot so that people can maybe deduct from their paycheck.
That's cool.
And make a contribution, a tax-free donation. And so we can raise money that way as well. We also go back to some of our employers, which they're welcome to be Samaritans as well. If we saved the plan made millions of dollars from what we do, we'll go back and ask them and say we would have never been able to do that unless someone first decided to unconditionally give. And so just keep us in mind and pay it forward. Maybe take a slice of those savings so that the next case that comes up, we'll be able to help.
Well, I'm even thinking, from that perspective, right? Our industry is chock full of good people, right? And not just individuals in the consulting world, the benefits world, but the actual benefits agencies themselves are very active in the charity world. And this seems like a very obvious way to connect what they do with what they want to do from a philanthropic point of view and put those two things together. So I can imagine, benefits agencies would be interested in giving as well. And then, of course, right, if one of their employers is a beneficiary from that too, then everybody wins, right?
Yeah, we'd love the agencies and the agents to get involved too. But when I was an agent, I really I wish something existed really for our industry. I remember specifically a story I had where a woman had like $30,000 in claims that she had an extra 25 visits for therapy or something, and came to me, I can't afford this. Well, I negotiated down to about $3,000. I thought I did a great job. I was so excited to call her and tell her that. But when I told her that, she goes, well, I'm sorry, but I have nothing left. This has bankrupted me, and it might as well be $1 million. And I thought it'd be nice if I was a part maybe of a foundation for our industry with other agents to just connect with that and make that go away for her. The employer couldn't help her. That'd be discrimination. Me as an agent couldn't help her. That would be rebating, But if I felt that we as agents, we have a beat on, we know what's happening with all of our clients, with all the people within there. If we'd have something to access just to help those people that are struggling, I think that'd be beneficial. And we have people using the foundation like that as well. The foundation, its help and its reach goes beyond just the cases that we find through the Samaritan Fund Program. Even some of the smaller cases, like someone who says, well, I only take my insulin half the time because I can't afford it, and I got a $6,000 deductible. Well, that is not severe enough for our program. That would be a decline for our program. But through our foundation, we're able to source that person a couple of $1,000s to help with that insulin.
That's awesome.
And also employers may get involved as well. They want to help a certain person with their situation. Unfortunately, just the world we live in, it would be hard for an employer to just give an employee money here. I want you to, well, that's discrimination, So they may contact us and say, look, we want to be a Samaritan, but we have someone here that needs help. Would y'all consider that? Yeah, of course. That's what we're looking to do. And they get involved that way.
Well, it's really cool. So you've effectively just created the environment for this to happen, right? There's a means there, there's a willingness there, and you've created the vehicle that allows for that transaction to take place, or I don't know if you call it a transaction, but the case or whatever you want to call the terminology there.
Yeah, if we could create a culture of reaching out for help when you need it and giving help when you have it. And that's really what we want to do between the foundation and the program, and cut out, really what, the insurance will do is paying premium back to the company and picking benefits. We can help each other. And like I said, there is a lot of people out there that want to help, and people don't know to reach out for it.
Yeah. When I say a beneficiary of this equation that we haven't talked about yet would be the stop loss carrier, right? Because ultimately, when you're self-insured and you've got $1 million claims, we talk about it all the time at Pareto, but stop loss carriers, those are the claims that they're most concerned about. And oftentimes, in situations where they're ongoing, of course, you can predict the likelihood through, a lasered claimant. But there's also those claimants that just pop up out of nowhere too, unexpectedly, that cost a couple $1 million, a premature baby as an example. So what is the stop loss carrier's perspective? I'm sure they're pretty in favor of this, although they'll ask a lot of questions. But ultimately, if a $1 million claim goes off the plan, well, they just saved $1 million of reimbursement or whatever the deductible is. So tell me about their perspective.
Well, they definitely have skin in the game too. Anything over the spec deductible or even then some. A lot of times we quantify what the success of our program would save by having them run 2 quotes, a no laser quote and then a laser quote. And what's that difference in the base rate if we're successful with that? But yeah, we do have come across these contracts that are no new lasers, max increase, and the stop loss. They've done the math that we're going to be paying out on this for a long time, and so we could be put in the category of a risk mitigation strategy, and finding a solution for those top claims other than the group plan. That's going to save them a lot of money too. So they definitely have some skin in the game too.
Well, and so this begs the question then, once somebody's aware of this, why doesn't everybody attempt to do this, at least with certain threshold claim or only my big claim? What's the constraints here? Is it a limited access to resources? Is it just because it's relatively new? Tell me some of the not the limiting factors, but where you are in the stage of life cycle. What are the things that you're up against that constrain it a little bit?
Yeah, so the constraints are making sure it's done properly with the funding.
Yeah.
If it was so easy that an employer just would pay the employee to do it, it
would have been done.
It would have been done. Yeah. And even more so if they would just, pay somebody else to pay them, it'd be done as well. The fact that, we have to build what we do through, the foundations and our Samaritans, we had to build that portfolio is a hurdle that we needed to compliance-wise, and a very complicated one and expensive one, but a necessary one.
Yeah.
And so that's why I think that complexity is really what stops most of these plans in their tracks.
Yeah, and so I imagine you have as a full-time job, going out and continuing to source those resources, those funds, right? And making people aware that this is possible. So does that where the philanthropic side, the foundation side of the house is? You have people that are doing that job in particular, sourcing the funds? Yeah,
so the foundation, we had to do that for a number of different reasons. Though it isn't necessary, someone who in the program, the funds don't necessarily have to come from our foundation. It could come from outside, another Samaritan source, or even some type of forgiveness of their bills as well. Just as long as we leave them with zero out-of-pocket cost to them, which is the goal. But we wanted control with the foundation. Logistics-wise, our use of the debit card is what makes everything so easy. And so if we had to go straight to the foundation, well, we'd have to use their paperwork and their grant writing. And so if we can convince them to let us control the funds through our foundation, we can cut through all that red tape and make it easier for everyone to do that. So also, having a 501c3, I've found that some of these foundations, they kind of use that as a credibility to vet
Sure,
someone.
sure.
Though it's not necessary, they say, well, are you a 501? We only are able to partner with other 501c3s, and so we needed our own to be able to work with them in that way as well. So being able to raise our own funds for our own cause, not just for the people in the program, but to help those as well, and to be able to work hand in hand with these other foundations too.
Yeah.
It was just necessary to have.
Yeah, so that you put all the pieces in place, but I can guarantee there's somebody out there going, I still don't see how that works. I don't think that's compliant, right? So talk to me about going through some of having this program evaluated and sort of vetted by third parties to say, okay, we've looked at it and we believe it's good, right? So I'm sure you did a lot of that due diligence on the front end to make sure it happened.
ClaimDoc is a medical claim auditing and member advocacy company. We provide fiduciary services to employer-sponsored benefit plans, and allowing them to create an environment where we ensure that the benefit plans are being charged in a fair and reasonable basis.
My business is basically people, and it become a real simple transition. We thought it was going to be far more complex. I've saved, we'll say, hundreds of thousands of dollars. I could not say enough about ClaimDoc.
Oh yeah, so we, like we talked about, this was all kind of tried to be done in the shadows, kind of in our industry, and so we wanted to bring this to light, make sure it's compliant, make sure it's safe, and so we went to the top law firms and attorneys in the industry to give us opinions on it. Our first opinion also they contacted the Department of Labor and told them what we're doing and get their blessing. So that was kind of included in their opinion. They said everything's good, and then we got that opinion vetted by other ones as well, which gave us the green light on that. So we wanted to make sure that it was compliant and safe on what we do. And I always get kind of the same concerns, oh, this is discrimination. Well, it's not, as an employer, it's not. First off, we're not a benefit. We're not an ERISA plan. Therefore, we don't have to abide by laws of ERISA like discrimination. Technically, you probably could go up to somebody and say, hey, I heard about the Samaritan Fund, and you might be a good candidate. You should look into it. But why even be accused of something, even if you're right? So that's why it's our recommendation, roll it out to all your employees. Same way, ubiquitously. Everyone can apply. Not all may qualify, and that's why you didn't discriminate. You gave everyone the opportunity to learn about the program, even though you didn't have to, and from there, it was their choice how they wanted to engage. And so that's why it's not discrimination. But yeah, we've addressed, and we've been tested in some markets as well, that we've come out clean. And those opinions have held true. So
that's good, man. And I guess the only perhaps entity that's on the receiving end in a negative way is the pool itself, right? Because these people are they going into ACA plans or fully insured plans or going on the exchange? Like they're getting another plan, correct? Yeah. And I don't even say it's a negative, but it's somebody's receiving that claim elsewhere, correct?
Yes. Sometimes we try to find a full solution for them, and it may not be leaving their employer. Sometimes we give funds to them, like I said, we had a guy with couldn't pay for his insulin, and so we were to help him with that. But if we're finding a solution outside of the plan, because like I said, a lot of these plans sometimes they're carving outside of the summary of benefits, things that are crucial. And so we need to help them. And so we find them plans that do that. We look at whatever's available to them in their geographic location. That's going to be healthcare.gov. That's going to be, and in some markets they have options that are not on the government exchange, but just an individual option. Okay,
very cool. Yeah, and so it's ultimately that person is benefiting because of they get they get a plan, their out of pocket's covered, it's effectively zero out of pocket. But is it an annually renewable thing? I mean, is it they're going to have to apply again for renewal at the end of that year? How does that work for continuity?
So we have a contract and it's for 1 year. We procure the funding for them for 1 year, and 2 months prior to it renewing, we reach back out to them. We see how things are going, and God willing, maybe they're healed. Maybe they responded to treatment. The cancer's gone, and everything's great. And if that's the case, excellent. Well, we got you through the time that we're designed to get you through.
Yeah.
And so we're not going to renew. But you're welcome to do what you want. I mean, you can keep your plan, or since it is open enrollment, because we dovetail it with open enrollment, you're welcome to rejoin your group plan at that time.
When I was here, I'm glad you brought that up, and that's maybe how we'll end the talk on Samaritan and move to the big picture stuff. But the timing of this, right? We're in the middle of fourth quarter. This is being taped on September 18th, right? And so 1/1 cycle is upon us, man, and it's in heavy swing. So what would it look like for a consultant that has identified an opportunity? The employer is open to a time frame for stuff like this.
So we want to be involved 60 to 90 days out, or even earlier for 1/1. Our 1/1 timeline is we want to be rolled out to the group in the month of September, and so that we're able to find solutions in the month of October. We want to be finished with what we do before open enrollment starts.
Yes.
Not only because we could have such a profound impact on that renewal, if we know that high claim is finding solution elsewhere, well, then you may take that laser quote. Or we have, a lot of groups that are fully insured that want to go self-funded, and they can't because of these high claims. And if we know that they found a solution, well, they're going to make a different decision based on that. Also, the participant needs to know, I have a plan. I have my plan already laid out, and when open enrollment comes along, I know to waive coverage because I already know what I'm going to do. And so we have to have that in place as well. So 1/1s, we like to roll them out in September, be done in October. Other than that, between 60 to 90 days out is when we want to get involved. And that's because, they need a qualifying event in order to waive their group coverage.
Well, as I say, in a perfect world, obviously you're having these conversations in January to be aware to plan for September if it's a 1/1. However, we know our industry doesn't always work as proactively as we'd like. So, oh my God, we've got a laser on this case and we need to do something now or we can't go self-funded. So I'm sure you're getting those reactive outreaches as well right now. And, so extenuating circumstances, urgent cases, you can probably work those too. Are you in the thick of that right now? People calling you?
Well, that's, we're still kind of on our preferred timeline right now, but I'm sure that,
November
we're going to get calls
in
November and December. Oh, this popped up, and we'll tell you right now, we can't promise we're going to finish those or have a solution, but they're going to come.
Yeah.
So
inevitably. Well, I hope they do, right? And as a result of this podcast, hopefully we'll get you some opportunities as well that come inbound. So kind of last couple questions as we zoom out and then end the podcast. You've been in the industry about the same time frame I have, a little over 10 years or so, and I'm sure you have some pretty good perspectives of where we're going. But big picture, maybe even outside of Samaritan, but big picture healthcare, right? What are the things that you're planning for in the next 3 to 5 years to be prepared for?
Healthcare cost, not only is it just going higher and higher, but it's becoming more of a burden on just the average family, and we're going to need solutions to help each other than just diving in to the insurance. I think there's a couple of fixes that they could do with it. I think if price transparency or passing laws on that to where it would force them just to give the same price to everyone. It would do away with networks. The way the costs are come up with, I think that's broken, and that needs to change. And the industry answer to that has been these reference-based pricing for that, but that's kind of like forcing its way into the market organically, but. For them it's almost an elaborate way of saying, well, what do I need for a hip replacement? And it's like, well, who's paying? It depends.
Yeah.
And so I'm not saying that, everybody needs to have the same cost. Your hospital, you may be very good at hip replacements. And so, you could charge, I think you'd be able to charge more. But that needs to be the same no matter where that bill is coming from.
Yeah, but I would say a healthy market where those forces are actually allowed to play out rather than being manipulated would mean, well, if you do actually deliver a higher value, then you could set your prices higher.
Exactly.
But if all things being equal, you should have to compete. And one of those elements that you compete on is the price that you deliver that service for. But like you said, that's not transparent enough now, right? And I think as we go over time, I like the proliferation of reference-based pricing. It's sort of exposing, Medicare costs and adding a spread that's still fair and reasonable based on what they're paying today. But the further we get along towards price transparency, I think it dilutes the value of networks even more because it shows how arbitrary those payment methodologies are.
It does. These reference-based pricing where they're trying to force the pricing on. I mean, think about this. Have you ever seen a commercial where it's like, we're XYZ hospital and we do the best knee replacements at the best cost. Come to us.
Yeah.
You never see advertisements like that. Why? Because when they form these networks so that individuals can sign on the network, now you've become a commodity that these networks can sell and say, okay, look at how many people we control and we're going to negotiate a price with you, the hospital. So the hospitals don't advertise on how they're the best for knee replacement because they're not making the decisions on where these people go. The networks are, and they're steering them to the places that they want them to go based on that in-network contract. If you did away with networks, you'd start seeing that. We're the best knee replacements. Come to us for this. Come to us for that.
Well, I'd love to see literally prices advertised publicly, like
Absolutely.
MRI $700 or whatever. Come to us. We'll take anybody. It's $700. You go down the street, it's $3,000. Come to us because we're the lowest cost MRI and we're just as good, right?
Right.
Well,
you don't see that.
You don't ever see that.
Because the network controls where you go, not supply and demand or price.
Yeah. Well, that would be the biggest fundamental shift that I'd like to see in our healthcare system. And I realize there's a lot of opposing forces that don't want that to happen, but I think the more that we talk about it, the more some legislation comes down that requires price transparency, I think hopefully it'll start exposing that more and more. So why don't we do this, Brett? Let's go ahead and jump, but why don't we say what closing thoughts? What's a statement or two that you'd like to leave the audience with?
I'll leave the audience with, look into us with the Samaritan Fund Program. Reach out to help others with the Samaritan Fund Foundation. We can, no matter what happens with healthcare or where that's going in the future, we can help each other. And the best way to do that is cut through, all the red tape and to reach out directly. And we can do that by identifying who needs help. And if you're doing well, be a Samaritan.
Yeah.
And help others that are in need. And we're only going to get through everything together, and that's the kind of culture that we want to promote. And if you are facing a difficult disease, and a lot of our participants are in a very dark place, there's hope out there, and we want to let you know, keep fighting. And we want to give you that win and want to give you that uptick, that there are people out there that want to help and want you to encourage you to keep fighting. And that's what we're all about. So.
I love it, man. Well, I hope in some little way it sheds some light on what you guys are doing. And, I wish you nothing but success. I think you said you started in 2020 and, things are going really well for you. And I hope that continues to be the case. So, Brett, thanks for lending your time. Thanks for traveling down from New Orleans. And hopefully this will be the first of many conversations we have.
All right. Thanks for having me.
My pleasure.
All right.